The Mini Mental Status Exam, or MMSE, is a simple test. It helps doctors check a person's thinking. Think of it like a checkup for your brain. This test looks at different parts of thinking. It looks at memory, language, and attention. Doctors use the MMSE for many reasons. It can help find early signs of dementia. It can track how well treatments are working. The MMSE is easy to use. It only takes about 10 minutes. The MMSE is not a perfect test. It cannot diagnose a specific condition, but it is a helpful tool. It helps doctors understand a person's cognitive health. Before starting the MMSE, make the patient comfortable. Find a quiet place without distractions. Make sure the patient can hear you well. Explain the test in simple terms. Let the patient know it's okay to not know all the answers. The MMSE is not about being right or wrong. It's about understanding how their brain is working. Have a pen and paper ready. You will record the patient's answers. You will also note their behavior during the test. The MMSE starts by checking the patient's orientation. This means asking them about time and place. Ask questions like, what is today's date? What day of the week is it? What year is it? Where are we right now? What city are we in? Each correct answer is worth 1 point. A score of 5 out of 5 means the patient is fully oriented. Next, test the patient's registration. This measures their ability to learn new information. Tell the patient 3 simple words. Use common, unrelated words like apple, table, and penny. Ask the patient to repeat these words back to you. This tests their immediate recall. Give them a few tries to repeat the words correctly. Each word remembered correctly earns 1 point. Section 5. Attention and calculation. This section assesses the patient's attention span and ability to focus. Ask them to count backward from 100 by 7s. Stop them after 5 subtractions. Another way to test this is by spelling world backwards. Each correct subtraction or letter earns 1 point. This section can be challenging, so offer encouragement. The goal is to observe their ability to concentrate and perform mental calculations. Section 6. Recall, assessing short-term memory function. Now ask the patient to recall the 3 words from earlier. This tests their short-term memory. Each correctly recalled word earns 1 point. This section helps determine if the patient can retain information after a short delay. It provides insight into their memory function. Section 7. Language examining comprehension and expression. The language section evaluates the patient's ability to understand and use language. Show them a common object like a pen or a watch. Ask them to name the object. Then, give them a simple command like, please put the pen on the table. Next, ask them to repeat a sentence like, no ifs, ands, or buts. Finally, show them a piece of paper with a simple instruction written on it like, close your eyes. Ask them to read and follow the instruction. Section 8. Copying, assessing visuospatial abilities. The final section assesses visuospatial abilities. Show the patient 2 overlapping pentagons. Ask them to copy the drawing. This task requires them to perceive spatial relationships and translate them onto paper. It provides insight into their visual processing and motor skills. Observe their ability to copy the shapes accurately. This task can reveal difficulties with coordination or visual perception. Section 9. Interpreting the results. Determining cognitive health and next steps. Once you've completed all sections, add up the points. The maximum score is 30. A score of 20 or above is generally considered normal. Lower scores may indicate cognitive impairment. However, many factors can influence the results. Age, education level, and cultural background can all play a role. The MMSE is a screening tool, not a diagnostic test. If a patient scores low, further evaluation is needed. This may include a more comprehensive cognitive assessment or referral to a specialist.